We'll move on to the second case, a 28 years primey, around 39 weeks of gestation, with a diabetes, gestational diabetes, induced with other things. Intraoperatively, postoperative LSCS was uneventful. At the time of discharge, this patient suddenly had a very severe headache, had a blurred vision, followed by loss of consciousness, a very nightmare. Somebody who was almost ready for a discharge with a discharge summary. All these cases are prototype cases which happened in the last few weeks in our hospital. We picked up the real-time cases. So I will just take ma'am's point. What will you think, ma'am, when this situation comes?
The first thing that goes in our mind is, am I dealing with a case of CSVT?
Yes,
because that
absolutely.
Typical, that severe headache is something that is, and even she is having this blurring of vision. And if there was, or if her BP suddenly has shot up, because nowadays we are saying it's not necessary that it's a clear-cut case of preeclampsia, but even after the labor, it can be a postpartum also. Yes. So if there may be a sudden rise in that, and it can be also, you know, a condition where you have, you know,
non-convulsive seizure or seizure-like activity.
Can have a seizure-like condition, or it could be a meningitis. So these are some things, or any bleed which is happening there. So these are the things that we have to keep in mind. So I think this...
Yeah, Vinita ma'am, any other comments on this?
I think yes, because she lost consciousness, I think everything got fastened up. But if it was just a headache, then we will not be thinking of anything like this. We will be thinking of, okay, she didn't sleep all night. Okay, she's day one. And maybe GDM, so maybe she's not had normal food.
Hypoglycemia can be maybe
high
one
BP or
insulin
low BP, or she is not hydrated, so low BP. These are the first things we will be thinking if she has headache. But because it's associated with blurring of vision, we will only think of HELP and preeclampsia and eclampsia. So if BP is measured and if it's normal, then follows the next step, which is loss of consciousness, then everything got fastened up. So then other things, like, you know, if it was associated with, as Dr. Jayanti said, seizures, it's very, very clear, and maybe we are dealing with CSVT or hemorrhage. But this is the things, because loss of consciousness, everything is really, we have to fast forward and think of major
Any comments, any wild guesses other than all? These are common points, like hypoglycemia, non-convulsive seizure, any possibility of other things, something like, as ma'am says, CSVT and all are. Aneurysmal bleed, okay. I just what I was saying, wild guess. Press syndrome, okay, Press syndrome, yes. Anything else? So this was also a nightmare for us. You will know how the family will behave. So these are the things which were considered: hypoglycemia, diabetic, on insulin, seizures, CSVT, and intracranial bleeds. And this was the CT immediate to that episode. So needing the subdural bleed, midline shift, and then the loss of consciousness, all putting together. After the CT, this patient was in a tertiary care center with a neuro backup, went directly to a OT for a decompressive craniotomy. Luckily went home happily and still alive and with the family. But the question is, this patient needed such a complex procedure after just LSCS, and we believe these all patients were on anticoagulation, which is now recommended by the discussions which we all see. So I will probably put some questions to Dr. Anita ma'am. How common it is to have intracranial bleeds?
Extremely rare, not 2%.
Okay.
But said and done, this situation has arisen. Is it a traumatic? Definitely to rule out trauma. I do not know the trauma factor is ruled out or not. Still, I have a suspicion of trauma there. Postpartum woman, we do not know if there's been a fall, a hit, whatever be the reasons. One is trauma. Otherwise, as the audience are coming up with clues also of aneurysms or
subarachnoid bleeds, which are more common. Okay.
Sometimes it might happen, the changes, physiological changes of pregnancy, if their vessel walls were not, good enough to hold all these changes, maybe it could have happened. And drug-induced, as you put it. If she were already on some anticoagulants for any other reason, if the history is not suggestive.
Even post-operatively, post-LSCS, you do start anticoagulants, right, as a prophylaxis. This patient was on prophylaxis.
Yeah, could have been a possibility. There could have been a possibility.
That's my second
because-
question to you. See, this patient came for LSCS, undergone a very uneventful, was almost discharged, baby healthy, was walking out, suddenly had SDH and no fall because the patient and attenders and nursing all were around, headache, blurring vision, loss of consciousness, all on the bed. So there is no scalp injury, no hit and everything. So it looked to me for in the initial day when ma'am said ki this was completely unexpected, the patient was on anticoagulant, prophylactic dose, enoxaparin 40 milligrams subcutaneous OD. So that's, I think, a standard protocol.
Yes.
So how frequently you use and how do you actually manage them? The family elects you initiated
Manage
anticoagulant.
this case or manage a case giving anticoagulants. I don't know if I have to manage this case. I only have to call Dr. Subbaiah. Any order, he said he'll pick the phone.
Okay. Ma'am, Vinita ma'am, CSVT will not be uncommon in these circumstances.
Not.
So how frequently it is in the
Actually,
postpartum?
compared to hemorrhage, I think CSVT is a little more common, but still very less common. Compared to West, we are a little more common to see CSVT. I think traditionally the reasons being anyway we have thrombotic tendency, and people don't give adequate water on the first day. This will add on to the thrombotic risk, and that's why maybe, and we are not so good in giving thromboprophylaxis as expected. I think all these factors will lead on, and moreover we have additional risk factor. We have good fat calorie intake bombarding the women in the last trimesters. We increase the risk of CSVT, so that's why we observe CSVT is more in Indian population compared to the West.
Okay, so we put on weight in the same. So the message from this case is clear. Common are common. Hypoglycemia, seizures, CSVTs are common, but destiny uncommon can be a possibility. So rule out that by a imaging modality so that you are clear on your heads. So this patient could have been gotten another anticoagulant dose, not considering possibility could have been a problem. So these all surprises may happen to you in an unfortunate situation.
Twice we had cases of cerebral tumors,
Leading to seizures.
the seizures. And
Yeah, that's a even more scary phenomenon to happen.